Hi and welcome to the College of Medicine compliance training video on Modifier 25. One of the most often asked questions when coding is whether or not to add a Modifier 25 to an E&M service on the same day as a procedure. The goal of this video is to provide you a framework for determining just this. First, let's take a look at what the modifier is defined as. Modifier 25 indicates a significant, separately identifiable E&M service by the same physician on the same day of the procedure or other therapeutic service. Both services must be significant, separate, and distinct. Also, important to remember, Medicare considers E&M services provided on the day of a procedure to be part of the work up for that procedure, and as such does not make separate payment. The exception to that rule is when the E&M documentation supports that there has been a significant amount of additional work above and beyond what the physician would normally provide, and it can stand alone as a medically necessary billable service. The use of Modifier 25 has been flagged for regular review over the years by Medicare because providers' documentation frequently falls short of what is sufficient to support billing for both services. While compliantly billing the E&M service with Modifier 25 requires some judgment, this checklist might be of assistance in making that determination. Let's go over the checklist. If you answer yes to all of the following questions, you are able to bill the service with a 25 modifier. Let's start. Does the documentation support an office visit? Does the documentation support a procedure? Does the procedure have a 0 to 10 global period? Did the provider perform a procedure as a result of a second problem addressed during the E&M office visit? Again, if yes to all the questions, bill the service with a 25 modifier. Let's go on. Do not bill a 25 modifier if you answer yes to the following questions. Was the procedure scheduled before the E&M office visit? Are services performed during a postoperative period related to a previous surgery? Did the patient return to the office solely to have the procedure done because the physician did not do the procedure on the day of the diagnosis? If yes to any of the questions, do not bill a 25 modifier. Okay, now that we've gone over the checklist, let's apply our review to some scenarios. Let's begin with case number 1. An established patient sustained a severe laceration to the scalp. Before suturing the laceration, the provider performed and documented a comprehensive history and exam to determine if the patient sustained some neurological damage. The physician then performed a 3.0 centimeter intermediate repair to the scalp. Based on the signs, symptoms, and conditions documented, the physician went above and beyond the normal preoperative work. Billing an E&M and the procedure on the same day with a Modifier 25 appended to the E&M would be appropriate. Okay, let's go on to case number 2. An established patient is seen for her annual well woman exam. She's given an age-appropriate physical exam, and the patient states that she has no new issues, but does mention her history of fibroids to the provider. The provider documents this in the patient's chart. Based on the documentation, billing an additional E&M with a Modifier 25 along with the preventative service would not be appropriate. Okay, let's look at our final case. A patient sees a dermatologist for a lesion on his right arm. During the exam, the patient mentions a rash on his leg. The symptoms have been worsening, so that patient has been unable to sleep at night due to all the itching. The lesion on the arm is removed, and the provider writes a prescription for the rash. Based on the documentation, billing an E&M and the procedure on the same day with a Modifier 25 appended to the E&M would be appropriate. As mentioned earlier in the video, the use of Modifier 25 has been flagged for regular review by Medicare. So let's go over some important points to remember. When billing an E&M service along with a procedure, your documentation must clearly demonstrate the purpose of the evaluation and management service was to evaluate a specific complaint. The complaint or problem addressed can stand alone as a billable service. You performed extra work that went above and beyond the typical work associated with the procedure code. The key components of the appropriately selected E&M service were actually performed and addressed the presenting complaint. The purpose of the visit was other than evaluating and or obtaining information needed to perform the procedure service. And both the medically necessary E&M service and procedure are appropriately and sufficiently documented by the provider in the patient's medical record to support the claim for these services. As a result of this education, we would expect that providers will use Modifier 25 only when they can clearly substantiate that that visit was medically necessary, significant, and distinctly separate from the procedure or therapeutic service they provided on the same patient on the same date of service. As always, please reach out to the Department of Compliance for questions, and please visit our College of Medicine Department of Compliance webpage for more educational videos. Thanks for watching.